Good morning, everyone. Thank you so much for joining us this morning for our last webinar for National Farm Safety and Health Week. Today we are presenting Safety and Health for Women in Ag, and we have, I hope I'm saying this correctly, Dr. Rosemary Koo with United Ag doing this presentation today. Thank you so much.
Great, thank you so much, Gabby, and that was perfect pronunciation of my last name. Hi, everyone. It's a pleasure to be here today. My name is Rosemary Koo. I'm a physician, dual board certified in internal medicine and preventive medicine. I still do practice a little bit in urgent care, but over the last several years, my primary work has been building technology to help reverse chronic conditions such as diabetes and hypertension and a number of other risk factors that can ultimately lead to kidney disease, heart attacks, and strokes. I was initially introduced to United Ag a few years ago, actually, through their Health Innovation Forum, and was brought on as Chief Medical Officer a few years ago to essentially further our goals in delivering greater empathy to our membership, and also to find and provide access to the latest technology and healthcare solutions to our membership as well. It's very hard for most of the technology and healthcare to trickle down to the end users, and it's essentially our mandate to do that. I was also very much inspired by our female leadership. Our CEO is Kirti Mutakar, who also leads the Women Ag Leadership Academy. And so it's my pleasure to be here today and talk about women's safety and health, because it's certainly near and dear to me and also our organization at United Ag. So first of all, here's our webinar disclaimer. And you can read through this later on. I can also make the slides available to Gabby. And first I'm going to start off with a cartoon here. So the ag industry today is actually made up about almost a third women. And when I saw this cartoon, I thought it really shined a light on the situation, is that even though we make up 1/3 of the industry, I believe we're still trying to fit into men's overalls, metaphorically, and that the industry was essentially built to fit the average size man, and both in the equipment and the personal protective equipment and even the culture. And when I saw this cartoon, the woman's asking the man, how about these overalls? And he says, no, I don't wear women's clothing. It made me wonder, if the gender ratio was reversed, say men were only 1/3 of the population, would they, kind of settle for trying to fit into a woman's world? And how absurd it is that women are trying to fit into a man's world largely in ag. Because first of all, we have unique body mechanics. Our center of gravity is different. Our limb lengths are different from men. And also our upper body tends to be significantly weaker than men, but our lower body is only moderate to mildly weaker than men. And so our strengths are very different. And also the personal protective equipment that's essential, from protecting us from exposures, needle sticks, etc., it needs to be fitted properly for a women's body. As you know, that if personal protective equipment is not fitted properly, this can actually put your life at risk. And in addition, we have unique anatomy and physiology. We have ovaries, uteruses, we have breasts, and we have a hormonal and endocrine system that can be very sensitive to some of the chemicals that we might be exposed to. And then lastly, I cannot overstate this enough, is that unfortunately in all industries, women still tend to do a lot of the household responsibilities. I wish this were kind of changed across the board, but not enough change has happened over time, and ag is no different. We actually at United Ag, we held roundtables recently to talk to our membership about what are some of the pressing things that they would like to have from us. And they actually said caregiver services, because so many of the women were caught between taking care of their children and also taking care of their parents or other elderly family members. And so that causes unique stressors for the female population that we have to address. And as a result of these unique circumstances facing women in ag, there are specific health risks. It's well known that cancers of the skin, lip, and the blood-borne cancers such as lymphoma, leukemia, multiple myeloma are more common in agricultural workers. Bladder and thyroid cancer is also linked to some chemical exposures in ag. And of course, the breast and ovarian cancers are specifically with women. Depression is also well known to affect women in ag more so than in the general female population. And there are actually multiple reasons for this. One is that, we talked about the unique stressors of women in ag. Certain chemical exposures can actually affect mood as well. And also some of the cultural issues for facing women in ag can also lead to depression. And I know that earlier in the week, there was a webinar on behavioral health. So I'm not going to go into depression, behavioral health too deeply, but we'll touch on it very briefly throughout the rest of the conversation here this morning. Third is that, because the equipment on the farms and also the personal protective equipment is not designed specifically for women, there is a higher risk of occupational injury and also therefore disability. And then lastly is reproductive health. There's certain risks that face women specifically that men don't need to think about. And to address all these, the three main pillars that I'm going to focus on are education, prevention, and advocacy. And all three of these are really critical for us to start thinking about how do we solve these problems specifically for women in ag. And first on education is that we need to really know what we're exposed to. You need to understand what chemicals or what risks are in your specific line of work. You can't be afraid to ask questions. The material safety data sheet should always be available to you. And that information is really important because if you do develop health complications, you need to know and tell your doctor exactly what you are exposed to at work. Second is with that knowledge, you have to, take care of yourself to do the proper preventive strategies, and we'll talk about that later throughout the webinar. And that's really kind of your own personal responsibility. And then lastly is advocacy. This is not only for yourself and your families when interacting with the healthcare system, but it's also think broadly about women in ag. So when I was preparing for this, I noticed that there was a lack of research actually for women's health issues in ag compared to other industries. And because of that lack of research, there is less awareness of the problems that face women. In fact, most of the historical research done on occupational risks in agriculture have been mixed research on men and women. They actually didn't separate out the data for women specifically. And so without that kind of knowledge across our industry, there's very, very little that we can do to solve these issues. So these are a bunch of health issues that are facing women in ag. I'm actually going to start off with reproductive health and kind of weave in some of these other conditions throughout the rest of the presentation. So first of all, the reproductive health issues of infertility, miscarriages, and preterm delivery are well known to specifically affect women in ag. And here's a quote from this very well-respected study that was done in the annual reviews of public health several years ago. And this is not necessarily meant to scare you, but to really highlight that this is a well-known issue and something that women need to think about even at the stage of preconception. So even if you're just thinking about starting a family, you're not even actively trying to get pregnant yet, do talk to your doctor. A lot of women across all industries will only go to their doctor once they become pregnant. But for you, because your fertility can be impacted by your work, you really need to go talk to your doctor even in the family planning stage. Once you are pregnant, the most common causes of fetal and infant death are preterm labor, birth defects, which are the birth defects actually affect, can lead, causes 1 out of 5 fetal deaths. Infections, placental problems, and uncontrolled maternal chronic conditions are the major issues that can impact your growing fetus and newborn. The greatest risk of pesticide exposures is actually during the first trimester. So most pesticides, the way they work is they actually disrupt the nervous system of the insects. And during the first trimester is when your baby's nervous system is developing. So that's why it's the greatest risk during that time. Carbon monoxide poisoning is also very risky if you are pregnant because it can lead to birth defects. So if you're not pregnant, carbon monoxide poisoning can lead to decreased oxygenation, loss of consciousness, and prolonged can actually have significant impacts on the adult brain. But can you imagine if your growing child is actually even more sensitive to that lack of oxygen? And then lastly, if you work with livestock specifically, there are several infectious diseases such as brucellosis and Q fever. And if you're exposed to any of the hormone medications that are given to livestock, you can be especially at risk of miscarriage if you have any lapses in the personal protective equipment or have any accidents on the job. So these are things to be especially vigilant about. And then if you are pregnant, there are a lot of changes that happen physiologically that can impact your health and safety on the job. And the first is weight gain. So weight gain can often affect the shape of not only your body, but also your face. And so you need to reassess the fit of your personal protective equipment to make sure it's protecting you as well during pregnancy as it did before you were pregnant. And then second is, as you become larger in pregnancy, your center of gravity does change. There's more stress on your low back especially, and even your sacroiliac joints can be affected. The sacroiliac joints are basically the joints where the two sides of the pelvis join to the middle of the spine at your low sacrum. And those joints actually become more mobile and looser during pregnancy because the hormones are released to help the pelvis expand in anticipation for the birth of the baby. So that can cause a lot of pain at those joints and also instability. If you have any issues at those joints, your doctor would typically recommend wearing a belt to help stabilize. So these are all body mechanic issues that can impact your health and safety on the job. Third is that during pregnancy, a lot of women develop anemia because their volume in kind of they retain water more easily, which actually dilutes out the blood a little bit. So you become anemic. You can become more tired than usual. So make sure your energy levels and hydration levels are suitable for the work that you're doing. And then there's an increased risk of developing gestational diabetes while you're pregnant. And the reason why that is because as the fetus is growing, the hormone changes essentially are trying to make glucose more available to the baby to help the baby grow. And so if you have gestational diabetes during pregnancy, you may have to be on medication that could potentially lower your blood glucose. And if your blood glucose gets too low on the job, you could faint or feel unwell or feel more fatigued than usual. Gestational diabetes is routinely tested for during pregnancy. So in case you're not tested for this around the 24-week mark, you need to absolutely ask your doctor about this. But most likely you will be routinely tested for it. And then lastly, something that we don't always think about is food safety, especially if we're eating near the workplace. You have to make sure that your hands are clean, make sure there are no environmental exposures that could get chemicals onto your food while you're eating, because like I mentioned, the fetus is just more sensitive to anything that you might be putting in the body. And after you deliver, there are also certain considerations for postpartum care in ag. Keeping work clothes at work is probably good practice if possible, for any women or any workers actually, to minimize any home exposure. Make sure to ask your workplace about lactation resources. Most workplaces are supposed to have a lactation room, so make sure you know what's available to you so you can take advantage of that. And then postpartum depression is extremely common, but it doesn't always, it's not always super obvious. So if you are starting to feel a little bit more blue than usual, or you find that you're not as interested in things that you normally love doing, you need to talk to your doctor because those could be signs of postpartum depression. And then lastly here, no one sleeps well when they have a newborn, unfortunately. And poor sleep can actually decrease your reaction time. Actually sleep deprivation, if prolonged, can actually cause people to act as if they were drunk. It's actually their reaction time is actually equivalent to being under the influence of alcohol. And so this is critically important, is that you have to be aware that you may be less alert and your reaction time may be lower than usual because you're taking care of your baby. And we're going to actually switch over now from reproductive health to general women's preventive health. And I'm going to go through some of the recommended health screenings that are put out by the U.S. Preventive Task Force. And the reason why this is actually really important is that anyone who works in a more rural area may not have access to these screenings, so you do have to advocate for yourself and know what you should be getting, even if your doctor doesn't mention it. I mentioned earlier in this webinar that breast cancer is especially at risk for women in ag. And so the recommended screening for all women is every 2 years once you hit age 50. The recommendation years ago used to be starting at age 40. So if you have a family history of breast cancer, or know if you're exposed to any chemicals that might increase your risk of breast cancer more than the usual population, talk to your doctor about it and they can make an exception to this recommendation. Certainly if you have personal risk factors, you should start earlier than 50 years old for this screening. Cervical cancer is also something that you need to be aware of. If you are between the ages of 21 to 29, you need a pap smear every 3 years. And if you're 30 to 65, there are several different ways in which you could do your cervical cancer screening that you can discuss with your doctor. It could be a pap smear every 3 years, or an HPV test. HPV stands for human papillomavirus. That's the virus that causes cervical cancer. You can do that every 5 years, or you can do the PAP and the HPV test every 5 years. So make sure you're getting these appropriate screenings. I know it's not fun to go to your gynecologist, but it's absolutely necessary. Colon cancer screening usually starts at age 50. This is for men and women. And there are multiple ways to test for colon cancer. The most common is actually doing fecal blood tests to make sure you're not having any abnormal bleeding in the stool. That's done every year. It's usually pretty easy. You just send in a very small stool sample. More well known is doing the colonoscopy every 10 years. So that's another option. And there are other types of colon imaging options out there. So definitely talk to your doctor about that once you hit age 50. And something that a lot of people don't realize is they should actually be screened for diabetes, certainly if they're overweight or obese, or if they have any family history. Doctors don't always do this for all the patients that have risk factors. And even if you don't have risk factors, but if it's for top of mind for you, you should be comfortable asking your doctor to do that. That's usually done with either a fasting or a non-fasting blood test. So it's super easy to do, and make sure that you have it and don't have it, or if you do have it, you have to be on the appropriate care for that. I'm going to switch gears to health maintenance behaviors. These are the things that I would recommend to you to maintain your health. You have to start with a good foundation in your body because you are exposed to things that could impact your health. Starting with a good foundation helps your body heal if you develop any complications from that, and also makes you stronger so that you might be more resilient to any of those complications. So the first is sun protection. Dermatologists generally recommend at least an SPF of 30. And as I mentioned before, skin cancer and lip cancer are especially prevalent in ag. You want to make sure you're using SPF in your lip balm as well. And just because you're using a higher SPF than 30 doesn't mean that you only have to reapply when you walk out the door in the morning. You should actually reapply any sunscreen on any exposed skin at least every 2 hours. And so the exposed skin is not just your face and neck, but it's also your hands, neck, and ears, ankles even if your pants are a little bit shorter, it's not necessarily a recommended for safety for that to be the case, but anything that is exposed to the sun needs to be protected with sunscreen. Second, you have to prioritize sleep. A lot of people in ag have to wake up earlier than the normal population, and you need to budget for at least 7 to 9 hours of sleep a night. Most patients I see need at least 8 hours, actually. And as you know, once you start getting ready for bed, you don't fall asleep right away. So I usually recommend that people budget an extra hour in that time to kind of wind down and then get to bed. And then the sleep time itself has to actually be 7 to 9 hours. So you have to go to bed earlier than probably you're used to. And sleep, if you're not sleeping well, is actually, sleep is not just a nice to have, it's a gotta have. Because if you're not sleeping well, you're more prone to depression, suicidal thoughts. There's studies that actually been shown that if you're sleep deprived, you're more likely to interpret other people's behaviors as hostile, even though they don't mean anything bad by it, but you have a tendency to view the world with a lens of aggression, which is not good for us in any line of work. There's actually research that shows that. And then also, if you know that you're snoring at night, or if you know that you're tired during the day, even if you've gotten at least 7 to 9 hours of sleep, you should probably be checked for sleep apnea. Most doctors think that sleep apnea only affects men, but it actually can affect women just as well. And sleep apnea causes you to wake up many times throughout the night. It places a huge stress on the body that can actually predispose you to conditions like high blood pressure and diabetes. Proper nutrition and exercise is vitally important. Your job is usually very physical, and so you need to fuel your body with complex carbs, enough protein, and healthy fats. Over the past several years, the dietetics industry has kind of come to the appreciation that fats are not the scary monster that it used to be, so we do need a lot of healthy unsaturated fats in our diet as well. You don't need to be afraid of those anymore. And even though your jobs can be very physical, getting enough aerobic exercise that's sustained over time is important. So for moderate exercise, you need at least 150 minutes per week of moderate aerobic exercise. If you're exercising very vigorously, that cuts down to half. So that's 75 minutes if you're doing intensely aerobic exercise. And do your best to maintain a healthy weight. Overweight and obesity has been linked to increase in injuries in the workplace. So if you're at a healthy weight, you can prevent that. Alcohol is also something that you need to watch. So for women, if you ever have more than 4 drinks in a given day at any point throughout the year, this is actually considered high risk alcohol consumption. And the average maximum that you should have per day is actually 1 drink. It's a little bit unfair because average recommended maximum for men is actually 2 per day, but but women that's actually cut in half. So do not have more than 1 drink per day. Don't ever have more than 4 drinks in a given day. And I would avoid tobacco at all costs. You know that you're probably being exposed with your lungs to things that could potentially cause respiratory conditions, and any exposure to tobacco smoke, either yourself smoking or secondhand smoke, can actually increase the risk of that. So I'd like to transition to how you can advocate for yourself in the healthcare industry. The first is, as I mentioned earlier, you have to know your exposures. And don't be afraid to tell your doctor about it, and do that at the beginning of your doctor's appointment. This is not something that you should mention at the end when your doctor is asking you, do you have any other questions? Tell your doctor about your current occupation and any prior occupation that might impact your health. And exposures are not just chemicals, but they also include fumes, dust, noise, temperature, vibrations, radiation, bodily fluid, insects, and also dehydration. In fact, there's some studies that shown that if you're not properly hydrated on the job, that can actually lead to kidney injury over time. And your exposures, if you do any of the housework once you get home, is not just related to your job, but you're also exposed to everything any of your family members bring in. So know what they're exposed to as well. And family members also include pets too. And make sure you know what your appropriate personal protective equipment is, and don't be shy about saying or telling your doctor if there were any lapses in that personal protective equipment. If a doctor doesn't know what you might be exposed to, they might not be able to think about, they might not have a proper differential in their mind of what could be causing your condition. So for instance, if I didn't know you were an ag and you come in with some body aches and cough, I might think it's a regular run-of-the-mill flu or upper respiratory infection. But if you've had those symptoms for a while, and if you've been exposed to chemicals during your work, that could be something different than just the run-of-the-mill flu. Here are some symptoms that you should never ignore. Chronic cough, any recurrent fevers. A fever is generally a temperature above 100.4, but even if you're a little bit lower than that and you're feeling that on a regular basis, you should definitely go see your doctor. Any blood in your urine is abnormal. There's no such thing as normal blood in the urine. Abnormal vaginal bleeding has to be discussed with your gynecologist. And yes, you know, if it were super easy to lose weight, it might seem wonderful at first, but if it seems too easy, you're not actually working at it, you have to tell your doctor about this, because that could be related to any of the cancers or hormonal disruptions based on anything you might be exposed to. Same with excess fatigue or lymph nodes, could be signs of something much more serious. So don't ever ignore those symptoms. And don't let your doctor ignore any of those symptoms as well. And lastly, you have to ask about any of the side effects of your medications and how that might impact your safety at work. For instance, a lot of medicines can cause drowsiness. Even allergy medicines that are available over the counter, such as Benadryl, can cause drowsiness. Even those that are labeled as non-drowsy can, in some people, cause drowsiness. Muscle relaxers and even neurological meds can cause drowsiness. And that can certainly make work dangerous for you. If you have diabetes or high blood pressure, those medications can cause changes in those levels at work that could put your health at risk too. So make sure those conditions are well controlled and you know the early signs of low blood glucose or low or elevated blood pressure. If you ever feel dizzy or lightheaded or have an extreme headache, shortness of breath, or chest pain, those may be related to those chronic conditions. Some medicines can even cause you to be more sensitive to sunlight, such as doxycycline, which is a very common antibiotic. So ask about that if you ever put on medications. And then very importantly is if you're on blood thinners, even a daily baby aspirin can cause your blood to be a little bit thinner and cause your clotting to be slower than usual. So if you do get a cut or any other injury on the field, you might be more prone to adverse effects from that. So just know what your risks are so you can take the proper precautions. And so lastly, I just want to have you walk away with the ideas that, progress in increasing women's health and safety in the workplace really it begins with greater awareness of the issues and advancing women leadership so that they can advocate for the female population. You have to keep yourself educated and protected. Don't be afraid to ask questions and dig in to any of the risks that you might be putting yourself in. And ensure that you're getting the regular health screenings, and also advocate for your health. Doctors don't always, they're often seeing many patients in a day. They might not think as broadly in your health as we would like them to. And I kind of say that hesitantly as a physician because I know it and seen that happen. So definitely advocate for your own health and don't be afraid to do that. Here are some resources. Again, I can make these slides available to Gabby for you. And then that's it for today. So thank you so much for joining us this morning. And it was a pleasure to be able to share this information with you.
Thank you so much, Dr. Rosemary Koo, for that presentation. It was very informative. Before we let her go, does anybody have any questions? We have this chat function on the bottom of your screen or a Q&A section on the bottom of your screen where you can ask questions if you have any while we have her. I'll give you a few minutes to see if we see any questions coming through. And when she makes these slides available to me, I will email them out to those of you who have participated today. Also, our next free webinar will be October 8th, where we will be talking about FSMA. I don't see any questions coming through. Thank you very much again for today's presentation.
Thank you so much, Gabby. Thank you for having me today. Bye-bye.
Bye. Have a great weekend, everybody.